Hi, this is Dr. Jordana Quinn with Core Regenerative Medicine, and today I would like to discuss frequently asked questions of my regenerative medicine patients. So the first one could be, what is regenerative medicine? Well, regenerative medicine is using your body's own natural healing processes to stimulate new growth and healing in an area. It can be used across many fields of medicine. It's super duper cool. But for the purposes of this talk, I'm going to use it for orthopedic purposes, but we do actually use it for vaginal rejuvenation. We use it to stimulate collagen in your skin, erectile dysfunction, hair loss, a whole bunch of things. And it actually is useful in all of those areas of medicine. So for regenerative medicine, in the orthopedic world, we use prolotherapy, we use platelet-rich plasma, and we use stem cells. Prolotherapy is actually taking an external solution, agitating the body, typically it's with a sugar solution like dextrose, and causing growth of new tissue and healing. We also use PRP, platelet-rich plasma, which is taking your bloods, concentrating down the platelets, stimulating healing that way, and we take stem cells. We at Core Regenerative Medicine take stem cells from your own body, and this is a very important distinction. We use either your fat and or your bone marrow to help stimulate growth of new tissue. There are some practitioners that buy stem cells from umbilical cord, and while this can have a useful application every now and then, it really should never be the only thing someone offers you. So in my opinion, if someone, if you want to do regenerative medicine and you see a practitioner and all they're offering you is umbilical cells and not giving you the option to use your own, I highly recommend running and finding someone else who actually at least can offer you the use of your own cells, even if that's something that you don't think you want. Another question I get asked all the time is it legal? And yes, it is very legal as long as you follow FDA guidelines. There's very specific FDA guidelines which we follow at Core, and we know. So it's legal. We're not taking little babies or little baby fetuses and taking their stem cells. That is totally illegal. Another question I get is, does it work? And the answer is yes. I take my oath as a physician to first do no harm very seriously. And if it didn't work, I promise you I would not be doing this type of medicine. I actually think it works and it does no harm more than surgery in a lot of cases, and even better, because with regenerative medicine, we're using your body's own cells to help stimulate a natural response and prevent surgery. And the cool thing about it is nobody has a bad reaction because you're not gonna be allergic to yourself, and there's minimal downtime from work or from a sport, or anything like that. So you're not missing work, you're not losing money that way. If you're a high-level athlete, you don't have to take such a large time off of your sport. You do have to take some time off. So regenerative medicine is super cool. A few other questions that I get asked is, will it take away my pain and how long until I feel a difference? And so it does take away your pain probably 80 to 90% of the time. It depends on what your injury is and which body part we're injecting. How long until you notice the effects? I've had patients as soon as 5 days feel better, but the average is really around the 6 to 8 week point where you're really feeling good and not having any pain anymore. So that's kind of it about frequently asked questions on regenerative medicine. Thanks for listening.